All right, let's talk about something we all hear, and maybe even say, pretty often. Phrases like, ugh, I'm so depressed, or I really need a drink. But what do those things actually mean when you look at them through a clinical lens? Today, we're going to pull back the curtain and explore the frameworks that professionals use to tell the difference between just a bad mood and a real diagnosis, or between one drink and a harmful cycle.
So let's start with this big question. I mean, we've all been there, right? We have bad days, bad weeks. It's just part of being human. So where's the line? When does that normal, everyday pain cross over into something that needs, clinical attention?
And this, right here, is the most important shift in thinking we can make. Clinically, depression isn't just a really intense feeling of sadness. No, it's a syndrome. It's a consistent, persistent pattern of symptoms that show up in your mood, your thoughts, and even your body. And, this is key, it lasts long enough that it actually starts getting in the way of your life.
Okay, so in this first section, let's dive in and break down exactly what that pattern looks like.
So you can see the distinction laid out here pretty clearly. Normal sadness, it's usually a reaction to something, right? It makes sense. It comes and it goes. But clinical depression is a whole different beast. It's this pervasive pattern. The general rule clinicians use is this. Are the symptoms there most of the day, nearly every single day, for at least 2 weeks? And, most critically, is it impairing how you function? Is it making it hard to work or to connect with people? That's the real difference.
And this pattern isn't just one thing. Think of it more like a constellation of symptoms. You've got the 2 core ones, that persistent low mood we talked about, and this other really important one called anhedonia. But then there's all this other stuff that comes along for the ride. Changes in your sleep, your appetite, you can't concentrate, you feel guilty. You can even see physical changes, like feeling all sped up and agitated or incredibly slowed down. It's truly a whole system problem.
Okay, I really want to zoom in on this word, anhedonia, because it's so crucial. This isn't just about feeling sad. It's about the absence of joy. It's like the color drains out of your world. The things that used to light you up, your hobbies, seeing friends, even listening to your favorite music, they just feel flat. And for a lot of people, that loss of pleasure is actually way more painful than the sadness itself.
And of course, this isn't black and white. Depression absolutely exists on a spectrum. So when clinicians are trying to figure out how severe it is, they're looking at the number of symptoms a person has, and they're combining that with how much those symptoms are impacting their life. It's always that combination, symptoms plus impairment, that tells the story of whether it's mild, moderate, or severe.
So that's the what of depression. We've defined the pattern. But now for the really big question, why? To get at that, we're going to use a really powerful framework that helps us understand almost all health conditions.
The first thing we just have to get out of the way is this. There's almost never a single smoking gun. You can't just point to one gene or one stressful event or one chemical in the brain and say, aha, that's the cause. The reality is so much more complex and interconnected than that.
And that's where this amazing tool, the biopsychosocial model, comes in. It helps us see the whole picture by looking at 3 big areas that are all tangled up together. You've got biological factors, your genes, your brain chemistry. Then you have psychological factors, your thought patterns, past traumas. And finally, you have social factors, your relationships, your job, your housing situation. A person's health is happening right at the intersection of all 3. And this is a total game changer because it means the solution isn't just one thing, it's about a personalized approach that helps the whole person.
Now, why does a model like this matter so much? Well, take a look at this number, 18%. That's nearly 1 in 5 adults reporting significant depressive symptoms. A number that huge tells you something really important. This can't just be about individual biology. We have to look at the bigger psychological and social pressures happening in our world. It's not just an individual problem. It's a public health problem.
Okay, let's switch gears for a minute. We're going to take these exact same ways of thinking, looking for patterns using these big holistic frameworks, and see how they apply to another huge health issue, alcohol misuse.
So to really get how misuse can become such a powerful repeating cycle, we need to touch on a basic learning process called operant conditioning. It might sound a little technical, but the idea is actually super simple. Our brains are basically wired to do 2 things: repeat actions that feel good and repeat actions that make us feel less bad. That simple reward system is the engine that drives this whole cycle.
And that reward comes in 2 flavors. There's positive reinforcement, which is what we usually think of. You drink and you get a pleasant feeling. Simple. But then there's negative reinforcement, and honestly, this one is often the more powerful driver. This is when you drink to take away a bad feeling, like anxiety or stress, or the symptoms of withdrawal. That feeling of relief, that is an incredibly potent reward that your brain very quickly learns to chase.
This all brings us to a really powerful metaphor in public health, the iceberg. The idea is simple. What we actually see in our clinics and hospitals, the people who are the most severely ill, is just the tiny visible tip.
And this chart really drives that point home for alcohol misuse. For every person who's sick enough to be in a hospital, there are so many more people out in the community drinking at risky levels who just haven't sought help yet. They're the massive, hidden part of the iceberg, just below the surface. And that right there is why things like community-wide screening and intervening early are so incredibly important. We've got to reach people before they hit the ice.
Okay, so we have our frameworks, we get the what, and we have a way to think about the why. So for our last section, let's get to the most important part. What do we do about it? How does all this knowledge turn into actual, real-world support?
You know, a huge piece of the puzzle in therapy is helping people shift from these less helpful or maladaptive coping strategies to more helpful, adaptive ones. So instead of isolating yourself when you feel bad, you learn to reach out for support. Instead of getting stuck spinning in circles of self-blame, you start to actively problem solve. It's really all about building a better, healthier toolkit for dealing with distress.
And that toolkit is built using strategies that we know actually work. We're talking about evidence-based support. This can address the psychological pillar of our model with things like cognitive behavioral therapy. And it can also address the biological pillar with medication, like SSRIs, which are often one of the first things tried for moderate to severe depression.
Now, here is a really crucial piece of information, especially when it comes to medication. It's not a quick fix. Antidepressants don't work like a painkiller. It can often take 2, 3, even 4 weeks to really start feeling a positive benefit, and you might even get some side effects before then. Sticking with it through that initial phase, with the doctor's guidance, of course, is absolutely key.
So think about the journey we've been on. We went from a simple feeling to defining a complex pattern to understanding its causes with a holistic framework, and finally to seeing the pathways to support. So I want to leave you with a final question for all of us. Now that we have these frameworks, what do we do with them? How can we use this deeper understanding to reduce stigma, to encourage people to seek help, and to build genuinely more supportive families, workplaces, and communities? That's something to think about. Thanks for joining me.